Sciatica. What's better, chiropractor or physical therapist? I'm gonna dive into that right now. So, all of you that are watching this that have sciatica, I guarantee you, you have been referred by your doctor to a neurologist, or your neurologist, orthopedist, or primary care physician skipped the neurologist and sent you directly to a physical therapist. I am a chiropractor, but I'm also licensed to do physical therapy as well, right? So my initial degree, I have a doctorate in chiropractic, but I'm a huge fan of physical therapy. We have 2 physical therapists here at our office. So we use physical therapy regularly. This is really important when we're talking about sciatica. So what is physical therapy? Physical therapy is the study of soft tissue, muscle, tendon, ligament. How often does a nerve get trapped by a muscle, tendon, or ligament? Rarely, okay? The problem is a lot of docs, just general physicians, orthopedists, even neurologists, just don't understand what chiropractic is. And I'm going to explain that in just a second. This is really important because you're putting the cart before the horse when you go to physical therapy. And if you don't get results, then you go do worse, surgery or injections and things. I can't stress this enough. Your doctor just referred you to the wrong person. Now, physical therapy is huge and important when we're dealing with sciatica. But after the pressure is taken off of the sciatic nerve goes to and controls a lot of the muscles that physical therapist is going to try to strengthen or stretch. But if there's pressure on the nerve, you could do whatever you want to that muscle. It's not going to do diddly squat. I almost sweared. It's not going to do anything as long as you keep the pressure on the nerve. You're not going to get anywhere retraining that muscle. You have to remove pressure off that nerve. And what doctors, orthopedists, neurologists don't understand is chiropractors are the only profession that removes pressure on a nerve, right? We're the nerve doctors, aside from neurologists. But we mix in the therapy, the PT, the chiropractic, the manipulation with that treatment, right? A neurologist is going to run a bunch of fancy tests like EMGs, and we do EMG tests here, right? On this other side of this wall, we do EMG, nerve conduction velocity tests, but those don't fix anything. They don't fix sciatica, and they already tell you what you already knew anyway from your MRI. So if you have sciatica and it's not piriformis syndrome, that's one of the only conditions where soft tissue is putting pressure on a nerve and creating the sciatica. It's called piriformis syndrome, but most cases of sciatica are not piriformis syndrome. Most cases are from a disc bulge or disc herniation being pinched at the spinal level, and only chiropractors are the ones equipped to remove pressure off of that spinal nerve or even the spinal canal, right? Which can also create sciatica-like symptoms. So chiropractors go in there and actually manipulate the joint, the spinal joints. Physical therapists don't. They release, strengthen, they work with muscles and soft tissue. So get pressure off the nerve with chiropractor first, then do physical therapy to strengthen and rehab the area so that it doesn't come back. I hope that helps you guys. I have nothing against physical therapy. I love physical therapy. We have 2 of them here, but often people are putting the cart before the horse and just leaving out the chiropractic for whatever reason. Now, as far as what chiropractic techniques work for sciatica, they pretty much all work, but some work better, like Cox flexion distraction technique. And if you want to learn more about flexion distraction technique, Cox flexion distraction technique, check out our videos. We even have a playlist of just videos on flexion distraction technique. Be sure to check those videos out. We've got plenty of Cox flexion distraction technique videos for you guys to view, and I hope you guys got some help from this video. If I helped you, if I helped explain things a little better, why physical therapy is not the best choice first. Now, for some of you, maybe you got relief from the physical therapy, and that's great. But for a lot of people that are still suffering, go see a chiropractor, then do the PT after the chiropractor eliminates all that nerve pain, that sciatic nerve pain. Thanks for tuning in, and I hope you got something from this video. Make sure you smash that like button. And we've got 4 new videos coming out every single week. So 16 a month. We've got over 1,200 videos. If you have a question about your back or your health, I probably did a video on it. Thanks for tuning in. Love you guys. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.